Look out, this is awesome. Okay, good morning, everybody. So I am honored to be here to talk about this topic, which means a lot to me both personally and professionally. And as I was thinking about how I might answer this question of should the mission of public health be eradicating poverty, I found that my answer was based in who I am and my experiences in life. So I thought it'd be important to be explicit about who I am in the room today and how that impacts my answer. And I have 3 answers. So first, I respond as the black child who grew up poor with a single mom in the South, working really hard trying to get by day to day. And my response would be, hell yes. Don't wait so long, get started right now. I also respond as a person, a social worker who's committed his life to ensuring social justice for everyone, including underserved populations. And as that person, I also respond yes, emphatically. Now, as a lifelong student who's using science to understand and innovate new ways to solve big social problems, I paused when I thought about this question. And I have a conditional yes. And so what I want to do today is tell you why I have that conditional yes. So my remarks are going to be based on a science of early development, early childhood development, and the impact of poverty. Now, before you panic and your eyes glaze over because I said science, I want you to know that I'm not a brain scientist, I'm not a neurobiologist, I'm not any kind of ologist. So I'll be giving you kind of an elementary understanding of the science. And for those who are expert in this, please don't write me and tell me all the things I said wrong. I'm really doing my best here to translate this for you. Because science means a lot of different things, so folks, I want to start by giving you kind of 4 underlying assumptions I have about science. The first is that for me, science is a unifying platform or framework across disciplines and multiple levels of intervention. And for me, that means that no matter how you come into the room, whether it's public policy, whether it's social work, whether it's medicine, science can be a place for us to start talking about something in common to help us get creative about what to do. It also means that it's not just about the individual that you're intervening with. You can have interventions at the individual level, the family, the community, national level. So all of those can be brought out in this. The second underlying assumption is that, although I will be talking about generally what happens to the body in science, I appreciate that we all are individuals and that how we experience different things and how we respond to them will all be unique. So please don't take the comments as absolute. The third underlying assumption is that for me, I interpret and apply science from a developmental lens, which means it's important to start early, but it's never too late. We all can learn things to keep going. Our brains and our bodies stay plastic for quite a long time. And the last thing, which I think is most important, is that I don't want the interpretation of science to be another label for blaming individuals for their circumstances. For me, science is about understanding how the environment impacts biology. It's not a question of nature or nurture, it's both. So that's my starting place. So, the science of early childhood development, what does it mean? Typically it talks about how brain development happens along with the roots of long-term health. And those are based on your early experiences. So, and that's positive or negative. Most folks talk about adverse conditions and experiences, and how when a child experiences an adverse condition, their stress response system activates, their brain gets going, the heart rate increases, and all these hormones get flushed out into the body to protect it. And that will go down if the adverse condition is removed, or more importantly, if there is a responsive caregiver who's able to help buffer the effects of that event. And we've all seen this if you've worked with kids, if you have kids, they're crying about something they're scared about, pick them up, soothe them, they're able to settle back down. What becomes problematic is when that adverse condition happens, stress response system goes up, and there's no buffering effect. So that system stays activated. And when it stays activated, it does at least a couple of things. One is that it changes the brain wiring. There are lots of connections happening in the brain every second when you're an infant. Some are strengthening and some are being pruned for the ones you don't use. When you're having those hormones flow through the body at a constant rate, you're starting to prune away some important connections that you'll need later for learning and health. The other thing that happens is that that elevated rate that's not buffered has the potential to be connected to poor long-term health outcomes. Talk about things like heart disease, diabetes, other chronic issues. What's most important when you think about this, and this is what folks mean about toxic stress, it is not the incident itself that makes it toxic. It is the incident and absence of a caring relationship to help buffer that. That's going to be an important theme as I talk through. So what does this mean for adults? Just like with kids, the cumulative effect of constant stress can disrupt the key skills you need to be productive and useful as being on a job and as a parent. Those skills are typically around planning, impulse control, goal-directed behavior, decision-making, judgment. And there are two ways that these stressors can impact the adult. One is the cumulative effect will cause you to not be able to access the skills that you've developed around managing day-to-day stuff. So here's an example, and that's called a bandwidth tax, by the way. I learned as the father of 2 young kids, and as someone who considers myself pretty balanced, being able to get through, successful, that lack of sleep, lots of demands, and potty training do not mix for me. When my daughter wants to play at 2 o'clock in the morning because she's gone to the potty and she's not tired anymore, I lose all rational thought. Right? I say things that make absolutely no sense to her and are completely ineffective. Like, if you don't go back to sleep, I will remove everything you own until you're 18 years old. Or my other favorite response is to beg and cry about Daddy having this big presentation he's got to go to and I really need some sleep. And she just kind of pats me on the head. That is so silly. That's bandwidth tax. But I know that's temporary. I'm able to get back to being functional and do the things that I need to do throughout my day. When I think about poverty and the impact on adults, you take the daily stressors of life, driving through Boston, getting emails from people that you don't like the tone that they send them in. You pile that on top of the stressors associated with poverty. Do I pay the heat? Do I buy food? Do I let my kid go to this after-school program? Do we buy Coke for the wintertime? And you pile that on top of a system that has been built with your stress response system on high for years. It makes it incredibly difficult to think about how not to have those adverse experiences that the caregiver is going through not become toxic for the child. And so this takes me back to my conditional yes. The thing that the center has been working on, our theory of change, is that in order to improve the long-term learning and health outcomes of children, you have to build the capacities and capabilities of the caregivers. And those are things like becoming social and economically mobile, long-term planning, goal setting, weighing different options, thinking about the future. So for me, when I think about the question for public health, about whether eradicating poverty should be their primary mission, I say yes, so long as the pathways include building adult capabilities. And I'm happy to talk more about the other work that we do related to that during the question and answer. Thank you.
I think I'm also better off on my feet. Thank you. That was wonderful, and actually, I'm here as a pediatrician, so it leads very much into what I want to talk about, because as you all know, I'm going to talk about poor children, but of course, children aren't poor individually. Children are poor because they are born into poor families. And I want to talk about what we can do to actually encourage the parents who care about them as much as we all care about our children and want to do for them exactly what we all want to do for our children, and how the job of helping children grow up to better ends is not something that, we do from above. It's something that we try to help parents do for their children. I want to say that it's an honor to be here. I want to wave to Dr. Barry Zuckerman there in the second row, who is the person who taught me an awful lot of what I'm going to say and who I'm probably going to quote later on. And as a matter of fact, as we were driving over this morning to the symposium, you said to me that you remembered Barry Zuckerman saying to you years ago, I got tired of treating children with asthma again and again, and I started to think about what we could do to make their homes less dangerous, less below code, less problematic, so that the children would not be coming in again and again with one asthma attack after another. So what pediatricians love, and you know this, is prevention. Not all, but an awful lot of the great triumphs of pediatric are preventive triumphs. We would rather immunize everybody against measles than treat a single case. We would rather help children grow up healthy than treat their illnesses and their problems. So the idea of eradicating, alleviating, mitigating poverty is a prevention approach. If we don't eradicate or decrease or diminish child poverty, then we spend our professional lives treating the effects on children, the effects on their development, the effect that you talked about, the effects on their physical health, the effects on their cognitive development, and the effects on their school function. And in this country, children are poor. They're disproportionately poor. 1 in 5 children in this country grows up in poverty. 1 in 4 very young children, children under 5, is living in poverty. So everything that you say about toxic stress and about the extreme effects on the developing brain, that's a lot of our children who are at risk. Now, if I were not here this morning, to pick up on what you said personally, if I were not here this morning, I would be seeing pediatric patients at Bellevue Hospital in New York, and in a piece of shameless dramatic self-promotion, I have brought along my stethoscope just to lend that reality, and I have also brought along, to carry the stethoscope in one hand, in the other hand, a little chewable children's board book. And the personal experience that I'm going to talk about will be with the program Reach Out and Read, and will be with the question of encouraging parents to look at books with their children as a strategy for building capacity in parents, for giving parents some additional tools to help them create those routines and relationships which can, in fact, buffer families living in very stressful situations. But as I say, if I weren't here, I'd be seeing patients at Bellevue. And well, as I say, children aren't poor. Children don't come in by themselves. Children come in with parents, children come in families, and they come in with a whole range of issues and a whole range of problems and a whole range of questions, and whatever we're talking about, whatever's going on in the room, we come back again and again to the effects of growing up in poverty, living in poverty. I mentioned the asthma and the conditions in which children live. You talked in your talk about the question of what kind of health care coverage you go, and we didn't even go into the details of just because you have health care coverage, does that mean that the pharmacy filled the prescription that we gave you last week? Or was it denied for any one of a huge, complicated list of reasons, all of which require the person who is supposed to be seeing patients to spend an enormously long time on an incredibly frustrating phone system while everybody else sits in the waiting room and gets angry? What's going on with you in school? There's a problem in school. You've brought a letter. The parents brought a letter. The parent can't understand the letter. It's not in the language the parent speaks, or even if it isn't the language the parent speaks, it's not easy to understand. I know that because it happens to be in the language that I speak. I read the letter and I can't understand it. The issues of what's going on in school. Well, there's been a problem in school for a while. We finally got you set up for an appointment in the development clinic where they do school assessments, and I see here that you missed the appointment. You missed the appointment because the mother says if she misses another day of work, she'll get fired. So she had to miss the appointment. She couldn't bring the child in. What else? Everything that happens again and again in the exam room comes down to the stress and complexity of people's lives. You know, you talked about being up in the middle of the night with your own child, and I think about the assignments that the families in our clinics have, just the logistic and the stress of getting there, of getting your time off from work, of getting the prescriptions filled, of going from place to place. And sometimes it feels like no matter how many wonderful programs we have a fruits and vegetables program here, and you can get vouchers and you can fill this in, and we have a program that might help your child get vouchers for a summer camp, and we have it. But each one of those stages in how you take care of your child, how you get care for yourself, care for your child, and the services you need involves extra steps and extra complexity and extra determination. You know what many of the problems are specifically that we see that are linked to poverty in children, and they range from asthma to obesity, to language, school-age language problems, you might call them. One of the things we say in our clinic is that regularly, when we're supervising the residents, every week or two, a resident will come in and say, "I have a genius 3-year-old. you should see what this 3-year-old can say. This 3-year-old is a genius, and inevitably, it's a 3-year-old with normal language for the age. It's the 3-year-old who can say at 3, it has moved on from what your daughter can say to you at 18 months or 2. And because most of the kids in the clinic, their expressive language is delayed, they're not saying anything like that. So a regular talking 3-year-old or 4-year-old seems a little bit like a miracle. School problem, developmental delay, all of the things that come up again and again, and all of the complexities of trying to address them that we face day by day. Now, a couple of years ago, pediatricians as a group decided to take on child poverty as a sort of organizational task, first in the Academic Pediatric Association, doctor that I work with at Bellevue, Dr. Bernard Dreyer, who had proposed this as a goal for the Academic Pediatric Association, that we should be trying to end child poverty as well as mitigate its effects, and it's now a strategic priority of the American Academy of Pediatrics. Again, the idea that what we want to do is to try to prevent what is causing so many of the problems that we otherwise have to treat. Now, what we do at Reach Out and Read, which is a program that is now getting on for almost 30 years ago, founded by Barry Zuckerman, Robert Needleman here, right at what was then Boston City Hospital. So what we do when we do primary care is I walk into the room with the stethoscope in one hand and the book in the other, and starting when children are babies, this is a 6-month-old book, right? It's chewable, and it has pictures of babies and parents in it, and it's got rounded corners, and we sort of model for parents how you look at a book together with a child, how you say, oh, there's the baby, there's grandma, and how you point to your nose and the baby's nose, and try to encourage parents to work this into their day and into their routines. And they get a book at every well-child visit up until they're 5 years old. And when I first got to know this program, I was writing about it. And I was actually interviewing Robert Needleman, who'd been a fellow here in developmental pediatrics and had developed this model, and he gave me this wonderful quote. He said, "It's a small thing to give a child a book. It's important, but it's small. It doesn't fix the neighborhood and make it safe. It doesn't fix the school. It doesn't fix everything else that's going on in the family. It doesn't help the parent who's depressed. It doesn't fix everything else, but it is a small good thing that you can do." I think that one of the things that I've learned over the past 20-some years working with Reach Out and Read is, yes, it's a small thing, but it does allow you to touch and open up and think about many of the other issues which you raised in your talk and which you already touched on in your response. What are we doing when we talk to parents about reading to their children, looking at books with their children, pointing and naming? First of all, we're talking to that capacity. It's a vote of confidence in what parents can do, in their importance in children's lives, in the importance of their voices, and in the importance of their will to buffer, if you will, to protect, to create routines and safety, even in a stressful world. And we hope it's a little bit of a tool that they can use to do all of those things. It's a gesture, a small gesture, toward physically changing the child's home and room. At least it's a room with a book in it, a bedtime with a book in it, a parent who's there to read to you. It's also a reminder of how much we're not touching and not changing. I would rather go to sleep at night in my own warm bed in a city in which the children are fed, in which their homes have heat, in which there are books in the home. But it's also a reminder, when you do it, time after time, day after day, of everything else that parents are struggling with and everything else that needs to be done to give them the chance that they want to do for their children what they want to do. It's been tremendously successful since the program started here as a single program. It is, as you heard, it's now in more than, I think, 5,400 clinics in all 50 states. We're reaching maybe 4.5 million children every year with this message and with these books. I think that the spread, certainly among pediatricians like me, it reflects two things. It reflects an idealism, a commitment to our patients, a willingness to go beyond the traditional model and to think about why health and learning and cognitive development and parent-child interaction all belong together. It reflects an eagerness to take that on and make that part of our mission and part of what we do every day. But I think it also reflects a sense of worry that the children we faithfully weigh and measure and immunize and, go down the list providing all the parental guidance and anticipatory guidance that we're supposed to do, that those children are coming back to us struggling in school, language delayed, that those parents are struggling with more than they can handle. And I believe very much in what I do, in Reach Out and Read, in the power of putting books into children's homes, into parents' hands, into families' lives. But I also know that as I do it over and over at Bellevue with my patients and talk to people who do it around the country, that it's a reminder of what we want to do, what we're able to do, and what we can't do in terms of giving parents capacity to buffer those adverse circumstances and giving their parents the opportunity to do everything that you talked about in terms of making the kinds of progress in your life that allow you and your children a real chance at the kind of healthy development in family life which builds you the platform for everything that you want to be and everything that you want to do. So I would say that it is a small thing to give a child a book, to talk to the parent about reading aloud. It's a small thing. It has a lot of large and beautiful and hopeful implications, but it's also a reminder that it takes very profound commitment on the part of larger systems and on the part of everyone working together to say these are in fact all our children, all our families, and we want to offer the kind of opportunity which really does prevent these problems, really does prevent them because it offers children a truly sensible and healthy and developmentally real road toward the tremendous potential, which is the joy of pediatrics and the joy of parenthood. Thank you.
Thank you so much for allowing me to be here with you, and I'm honored by my colleagues' intelligence and compassion and passion. Some 36 years ago, close to the day or so, I was riding the old Orange Line, which was just a block from here, a little rickety and a little high, but quite interesting, to my first evening of volunteering at Rosie's Place, which was the first shelter in the country for poor and homeless women. And I met a very special person on the subway stop platform. I was in the old, going from the red line to the orange line, it may still be there, it was this very narrow staircase, and this woman was bent over with her bags, and I thought she needed help, and I offered to help her, and she started shrieking and yelling and screaming at me and stormed all the way up the stairs and then down the entire subway ramp pointing at me, and I thought, oh, that's who I'm going to meet today. And not only did I meet her, I did not realize that Alice was also the Virgin Mary and the Holy Mother, and that she would, in fact, change my life. And the woman who started Rosie's Place, Kip Ternan, who also would, in fact, change my life and impact me and hold a bar so high for me and everyone we knew for the rest of my life. Kip would have liked Professor Bicknell. From what I hear, he swore a lot, threw the F word out, and she probably could have beat him at that. So she would say, F yes, eradicating poverty has to be the mission of public health, and I can assure you of that. This question of poverty or public health is about humility, and it is about values. Poverty sucks. It is getting worse in this country. It is unfair, it is cruel, and it is mean-spirited, and most of all, it is unnecessary. It is incumbent upon all of us to do everything we can to eradicate that. And the fact that we live in such a wealthy country and that it's getting worse is completely unacceptable. When we talk about numbers of unemployed, we're not counting the people who aren't collecting unemployment insurance. We're not talking about children or elderly people. We're not talking about the millions and millions of undocumented people, nor are we talking about the 2.2 million people incarcerated, or probably 7 million people floating in and out of our jails and houses of corrections each day. So we are missing the bigger picture. In addition to talking about the science that I think Chuck explained far better, than I won't even get into it, the other thing that's really come about is the impact of scarcity. Not only impact of stress, but the impact of scarcity and less on our brain and all of our ability to succeed. So if you have not enough food, if everything is less, if everything is taxing, if food is too expensive and housing is too expensive and you can't get enough hours and we don't pay people enough to live, that impact on the brain as well as the well-being is enormous. So the question becomes, what do? You can't blame people. It's not their fault. We need to try not to do stupid things because we all do lots of stupid things. We do need to do something. The recommendations are great. They're not enough. We need to create more access to opportunities. We've got to figure out how people are fed because we're not feeding people enough before we even can get to the next thing, and housing. And so the question is, what can you do? And can we collectively put together enough things that we can increase access for people who don't have it? How do you reach out to people who aren't even willing to reach out for what they need? And how do we keep learning and working together? We have to keep talking. At Roca, what we've done, we have the privilege of working with young men and young women who are at very, very high risk for really risky behaviors. They're deep into the criminal justice system. Young mothers who are unable and unwilling to show up, not through any fault of their own, just where life has taken them. We tried all the programs that you wait for people to come to, where you open your door, and that didn't work. And so we sort of flipped it on its side and said, okay, we're going to figure out how to create opportunities for people who don't appear to want them, they really do, for people who aren't going to show up for a long time, so that we give it enough time. We need to get people on ramps or exit ramps out of the desperation of poverty and onto the rest of life. At Roca, we really are working with young people who are not even at the starting line. How do we get people into the margins? We have millions of people in this country who are not even in the margins. So all the great things you think we can do, if you get this job training and you go to this and you set this up and you take care of this, I think the doctor so beautifully explained, well, you can have food, but you got to go get this voucher and you got to go over here, and you can have this, but you got to get that and you got to go over here. If you don't have enough room, if you don't have the bandwidth, as Chuck so adequately explained, it's hard. So we've got to figure out, we've got to create enough space and enough time. So in our small way at Roca, we've tried to create something over time that's built on relationships, because people, children, change in the context, all of us in relationships, that gives young people enough time. We spend 4 years with people, mostly who don't want anything to do with us for a long time, and we just hang around and keep going and knocking on the door and going out in the street. We've tried to build some place, one place where they can come to get more of what they need in one place, and to tolerate and to give them the room of when it's too hard, when it's too stressful, when they come, when they don't. We know people aren't going to come every day. If they could come every day, they don't need to be here. We're working on brain development in our own way. We've worked on a sort of a life skills, cognitive behavior therapy, which I need myself, to help them learn to think different, to act different, and to heal the brain, and so they can be the parents they want to be and the people they want to be, and then try to access them to opportunities around employment and the things they need in life over time so they can succeed. I think this morning about Emily. She came to Roca when she was 21, 4-year-old son with major health issues. extremely abusive boyfriend, father of her son, unable to show up regularly, and just hurt. And over time, Emily has gone to work. She set a lot of limits with the father of her son, and it was important for her to maintain that relationship. Her son has gotten the help he needs, and life is better. But we needed to give Emily a lot of room and a lot of love. Going back to these questions of value and values, humility, I'm humbled to know Emily. I'm humbled to know Alice, the Holy Virgin Mother Mary, that she was. I cannot imagine how hard it is. We don't have a country today where you can live on so little. And that's why we're seeing more people on the street and more people hungry and more challenging issues. And I come back to values because this is an issue that we can end. And we either value our children and every person enough to work on it, or we don't. I don't think we can afford not to be optimistic. I don't think we can afford not to be hopeful, because it is our privilege and responsibility. So thank you.
Thank you to our panelists. It's relatively unusual in the academic world to have a panel with such a broad set of perspectives, but also complementary on the same issue. Thank you. So we have about 10 minutes for questions now, and I am actually going to cede not asking the first question and let the audience ask the first question. To any of the panelists, we've asked Dr. Danziger to also join the panel, so you can direct questions to him as well. Sir, well, let's get a mic down here.
Setting a big, hairy, audacious goal such as this one works better for me if we had some way to do metrics. So if we were going to set a goal to go and eradicate poverty, how would you know you were making progress?
Well, are these on? This is on, okay. So, you know, economists are simple. They have a metric, which is money. And I think that's why the panel was a great compliment. It is the case, I think when you were talking about scarcity, you were talking about the Mullinahan and Shafir kind of work on bandwidth. So that's a very good example that while economists are looking to raise the incomes, raising the incomes has these not only long-term effects on the kids, but the kind of bandwidth effects that they talked about. So but in some sense, I think particularly what Molly was saying is that if you got to this point of the U.S. had a social safety net and tax system that looked more like Denmark, there would still be people who would need a social service sector and the kinds of services that her organization is trying. It's just that I suspect, I don't know, that child development in Denmark kids experience, a much smaller percentage of kids experience toxic stress than is the case here.
Let me ask a question on the panel while everybody else musters up the courage. This is always a shy crowd, so this is typical. In a world which I believe Professor Danziger characterized as a data-free public policy, which really is at odds with some of the compelling stories we heard from the panel. I would like to direct this question to the panelists. What is our collective responsibility, and how do we collectively act to reverse the tide on that, to make sure that the narratives that you all shared with us actually inform public policy rather than allowing these sort of two universes, a flamboyant data-free public policy and a sort of fairly clear call for engagement of public policy with real issues that seems to be avoided by the mainstream setting of policy? I know it's an easy question, so feel free to jump in all at once.
So I'll try this. I think a couple things. First of all, I think we have to talk about it. I think what's really brilliant about this morning is that you are talking about poverty. And as you said earlier, no president for years and years and years and years has even discussed it. It's just, we're not going to talk about this. It's too hard. So we need to talk about it. Because if you don't talk about it, you can't address it. I think the other thing is, as you talk about it, how do you bring people together in a different way and look at different aspects of what it would take for people to move out of such a painful and destructive place. I do think you can set interim metrics. I believe that. They might all be different, but it might be around brain development. It could be around engagement if people are highly disconnected. You need to have some interim metrics here so that you can understand you're on the path, as opposed to we have these great ideas over here and we're never going to be able to tell. And I think that we have to believe and act on that it's possible. So that if we get to, this is too hard, it's too painful, well, we can't do it, it's too big, then we're not going to do it. And so we've got to figure out, I joke a lot, people tease me, but I think my mother taught me this, like, how do you eat an elephant? One bite at a time. So, what's the elephant and what are the bites we're doing and how do we start to move in the right direction? Because I think we can.
I think I would just underline everything Molly said. My experience is that people get overwhelmed with the word poverty. And they say, well, it's been around for 50 years. What am I going to do about this? I do think that choosing to act, and that goes beyond the talking, is a start. Prioritizing it with some measurable outcome, and as Molly said, they'll all be different, forces you to focus on that. I often think that systems and organizations respond as if they are operating from a place of toxic stress, that it is just so disorganizing and disorienting, you don't know where to start. And if we can come together and just say, we need to focus our attention here. When you start to focus your attention, things start to happen. And you learn from that, you collaborate with other people, and you keep the process going.
In my other identity, I run a journalism department. And we think and talk a lot about what stories get told, what stories are, forgive the expression, sexy, what makes it possible to pitch a story. We may be living in an era when data are not fully informing policy. We are living in an era when there's a great interest in what stories data can tell. And so back in the day, we would always say, statistics aren't the story, whatever the quote is, however many terrible deaths are a statistic, one death is a tragedy, you've got to look for the representative story. I think there is actually an interest now in the stories that lie hidden in interesting ways in data, and in the stories that you can tell by looking creatively with different kinds of lenses. And I think that opens up a real opportunity for people in the worlds of public health and public policy who have been more accustomed in the past to talking to each other and to sort of waiting for the pros to come in and translate this for the world. I think there's actually an interest and an appetite for what you can do in a sophisticated way around data. I mean, if you wanted a job teaching in my journalism department, the magic words would be, I can teach data journalism. And so I think that for people who are comfortable and confident with data, there's an opportunity now to think about what are the stories within the data which people need to understand. And if you can't always start with the politicians and the policymakers, perhaps there is an opportunity directly with the public.
Professor Foster has a question. I think there's a mic coming your way.
First, I'd like to thank the panel for a really wonderful morning. Very, very stimulating. It seems to me that the poor have become invisible politically. And I don't know whether this is a recent phenomenon, and we're content to be very cruel. We're content to allow very cruel policies to be implemented, and no one really bats an eye. It's all about the middle class and so on. So I just wonder if, first of all, if my perception is correct, that they've become politically invisible, and secondly, what can be done about it? I don't see leadership emerging, and in a way, the unions used to take that role to some extent, and maybe the SEIU does still to some extent. But I just wonder, there seems like no one is speaking for the needs and the aspirations of very poor people here in the U.S.
Well, you mentioned SEIU, so since I was such a downer, Molly got the applause for being uplifting. I'm trying to think, but activist groups, SIEU is what did it. The $15, that has had resonance, and a number of states and localities are raising the minimum wage, and shockingly enough, even Walmart is raising the minimum wage, and it was sort of funny. Wall Street is pissed off because Walmart said, they're going to raise their minimum wage to $10 an hour by next year, and profits fell. Of course, the Walmart family is worth $148 billion, But anyway, they lost 6% of their wealth. So I think there are examples. I think Occupy Wall Street, while it fizzled, did get inequality into the public agenda more. So, the issue is, even the Republicans are saying inequality is a problem. They say it's because of Obama, but everything, global warming, Obama, it's all Obama. But so I do think you're right, and the issue is, Perri may know more about, what is it when some things stick and some things don't. So I'm reminded of a long series in the New York Times about the homeless child named Dasani, which the New York Times ran. Everybody I knew was impressed by it and thought how terrible the situation is. And there's some examples. De Blasio I closed the shelter in which her family was living. On the other hand, I know the journalist and have talked to her. She's writing a book. The reaction of a lot of people was, well, what a terrible mother. The mother was, not how terrible the conditions they were living. So there's a lot of truth to what you said, and also what Perri said about the stories capturing the issue.
I would just add that not only are the poor often invisible politically, but it's a byword in pediatrics, the children are invisible politically, they don't vote. And that therefore, say, when you talk about, which we didn't specifically reference today, but you, in your talk, you sort of said the group that has the safety net at this point, if anyone does, is the elderly, and that was a very specific set of programs and policies and determinations which changed the likelihood that in this country you would be poor when you're elderly. They vote. And messing with those programs has political consequences that messing with programs that affect children has never had.
There was, go ahead, Molly.
Just to say a couple things, obviously in more and more states, people who are incarcerated with felony charges are losing their right to vote. Obviously, people are not documented, although they're living here and participating in the economy and raising their families, they're not able to vote as well. I think that's just important to note. I think we have to start talking a whole lot more and getting it back into people's consciousness.
There was a question in the middle over there. Yes, right there in the middle. There's a mic coming your way.
I wanted to comment first that I also think it's important to recognize the Black Lives Matter movement as essentially a movement against oppression based on sort of externals and closely, the relationship between racism and poverty in this country is so profound that I think that has to be thought of as part of a very positive response as well. I wanted to take what Dr. Carter said and flip it on its head and ask, can we engage in any form of health education around behavior change that doesn't first say, let's try to eradicate poverty? Not can we engage in eradicating poverty without first engaging in sort of improving people's behaviors. I work for the Boston Public Health Commission, and we spend an awful lot of time engaging in health education programs, and we can tell you a million things about obesity and child obesity and its long-term health consequences, and it is incredibly unequally distributed by race and class, as we all know. But giving people guidance about exercise when their streets aren't safe, when they can't afford good food, when their lives have so few degrees of freedom that they really don't have opportunities to engage in things that middle-class people and well-off people take for granted, I think is just a doomed strategy. And I think that applies around parenting as well. It's not that I don't think we should give people extra support when the stresses they face are overwhelming, but recognize with humility, as Molly said, that variability in parenting is not based on other, sort of poor people not having been lectured enough, but rather on their needing extra bandwidth in order to put up with the stresses of poverty. I think it's a real mistake to establish as a gold standard white parenting in the United States or upper middle class parenting. I think there are some real questions to ask about the directions we're going in as a country that raises children in general, culturally as well as materially. But clearly it seems to me the stresses faced by low-income families, families of color, make that an enormously difficult challenge. So I guess it's a question for all of us. Can we imagine success if we don't challenge poverty, both in terms of thinking of concrete strategies that take it on, like supporting the earned income tax credit, which, by the way, has a dramatic effect on infant mortality rates, probably because it's the only program that gives poor people a bunch of money at once to do something really important. Second, by at least addressing in our health education the impact of poverty on the people we're talking to.
Sorry, I'm trying to remember the question.
It's taking what you said and saying, you were saying let's not address poverty without doing parenting education. I'm saying should we be doing parenting education if we're not addressing poverty?
So thank you for saying that. One thing I want to clarify is I was not talking about parenting education. I was talking about building adult caregiver capabilities. That's very different. It is those core skills, as I talked about, that you need to be successful in a lot of different dimensions of your life. As a practitioner, what that looks like to me, and what we did when I was in my other organizations, is we would start with asking families to tell us about their dreams about themselves, their dreams about their families. It wasn't about, how do you get out of poverty? It's what do you care about? And we use that to craft a plan with their input about where they wanted to start. We had typically 5 areas that we looked at. However, wherever they wanted to start is where they want to start, because this has to be driven by their motivation to do something different. So how I've done the work is around dreaming, not about parenting education or eradicating poverty or any of that.
I would just say that working with a broad array of families who do have in common that most of them are living in poverty, there's a huge range of what parents are doing, what parents are able to manage. There are, and how complicated, I tend to call it the assignment, that is to say, the particular children you've been dealt, the particular set of life circumstances, and that's not just true for families in poverty. That's true with any set of families you work with. And I think it would be a mistake not to feel that there are a great many parents out there who, despite the fact that there are all kinds of adverse circumstances, are, eager to take and build on any opportunity. I lamented the complexity of what people sometimes have to do logistically, but I am awed by some of the parents we work with who, who manage it and, take advantage of every possible opportunity for themselves and their children, sometimes to the point that, it leaves you exhausted. And I work with an awful lot of parents as a pediatrician who I know are doing things that I would never manage, who are, moving through the system, moving their children through the system with a kind of genius and verve that I don't think I could muster. So on the one hand, obviously, I think it's tremendously important to keep in mind some of the people that you talked about, the parents who, and the families and the people who are sort of so marginalized or so far off the margins that you need to go beyond this. But I certainly don't think you would want to stop offering everything you can offer and supporting the people who are able to make use of it. I think there's a tremendous amount that many parents are able to do for themselves and their children, and it's kind of a privilege to be able to offer it and support it.
I'm going to stop us here. There is lunch outside, which everybody should take, and the intention behind that was to continue the conversation informally. I think it's actually very difficult for anybody in public health, or really anybody of good conscience, to emerge from a discussion like this and not see the centrality of poverty in the production of health for all of us, and to emerge asking oneself, what can we do to deal with these issues for the sake of improving the health of the public. Please join me in thanking our speaker and panelists for a tremendous morning.